Live in high definition, this is WSBT News first thing in the morning.
What does the new health care law mean for you? This morning, WSBT begins a day-long look at the law many call Obamacare.
Americans are now constitutionally obligated to buy health insurance.
It's officially called the Patient Protection and Affordable Care Act, but many know it as Obamacare. It's the most complex law since Medicare. All day today at WSBT, we're examining the important topics related to health care reform and what it means for all of us. WSBT's Rick Shutt has our first look.
We start this morning with the role our government is playing. That is setting goals and objectives for the balance of the country and the ground rules associated with the law. Now, the Affordable Health Care Act intends to insure America from the current 88% to 93%. Now, that 5% increase may not sound like much, but the dollar amount to do that is in the billions. And now that we are post-election and President Obama is in his second term, the speed of rulemaking with the new law is taking a fast and dramatic turn. Now remember, repealing the law is no longer an option, but reforming it is. To help us make sense of the health care reform, we enlisted the help of Gutierrez, the president and CEO of St. Joseph Regional Medical Center.
The biggest expectation, which has been validated by the Supreme Court, is there is an individual mandate in the country. Americans are now constitutionally obligated to buy health insurance under penalty of the IRS. So that is a big change. So it's their responsibility. It's very similar to the requirement in the state to have auto insurance when you drive your car. So once a year, choices will be made in something called the Health Insurance Exchange, which every state is now required to open. It'll be the new marketplace with which individuals can buy insurance under the individual mandate.
And because of that mandate, you can be penalized by the IRS if you don't comply with the law. It starts January 1st, 2014. Now, coming up at 6 a.m., our next look at what health care reform means to you as we focus on health systems here in Michiana.